Wikidonist.com. Truth about tooth.
Have you experienced dental pain? Most of the people who have experienced dental pain say that it is one of the most excruciating pain that a human has to endure. So, what will you do if that happens right in the middle of the night where there is no dentist available on call? Or what do you do if it happens right on a day of your marriage? What are the reasons for it? Or how do you treat the dental pain? And what are the things that you can do at home to reduce your dental pain? That is our topic tonight. I am Dr. Thomas Nechupadam, and we are dentists at Marine Drive, Cochin. And this is my channel. This is Wikidonist English. So if you are seeing it for the first time, please subscribe my channel and put that bell button on so that you will get my messages on your YouTube. So what is dental pain? How does it happen? Most of the time, dental pain is caused due to a dental caries. As you know, dental decay is one of the reasons for losing teeth, and that is one of the biggest reasons for getting dental pain. But there are other reasons too, like gum issues can cause dental pain, and even food getting in between the gum, between the two teeth, or getting deep into the gums can cause dental pain. There are other reasons like sinusitis, which can cause somewhat like dental pain. So what will you do if you have a dental pain? And there are joint pains which looks like or feels like dental pain, or your wisdom tooth which is erupting can cause dental pain. Even in the small kids, when the tooth is erupting, there is some pain in the mouth. So these are all pains, and we need to treat them, and we need to get rid of them. So how do you do that if at all it happens at home? So this is a home remedy class for all of you. If at all you meet with the dental pain or a dental issue, what to do at home. The first thing what I'll tell you is, if it is caused due to a food impaction, especially if you have a space between two teeth and food has gone in between, the first thing before you take a pill is to remove the food. How do you do it? Most of the time people do it with a toothpick. I'll tell you not to do that, because the toothpick itself can hurt your gums, one. Second thing is, it can cause your toothpick fibers to get embedded into the gums and give you even more trouble. So what to do other than that? So you know it, and that is the dental floss. The flossing is the best way, but if at all you don't have the floss, or if you are not used to doing flossing, you might not have floss at home. What else to do? Take a nylon thread which you use for stitching, or a cotton thread, and put it in between your two teeth and just move it across so that the food gets out. So that's the first thing you have to do. Even if it is from caries, most of the time what happens is food would have blocked the cavity, and the infection is not able to breathe out all the difficult impurities and infectious material, so it is getting stuck there. So that is why most of the time the pain is. So the first thing you do is removal of food. You brush, you do a flossing so that the food gets out of that cavity or the space between the two teeth, so that the food is removed. The second thing what you can do is use a hot saline gargle. Take some little bit of salt, put it in warm water, and then you start gargling in your mouth so that you will get a little more relief. The third thing what you can do is to take a simple Panadol, or something like a paracetamol, or a acetaminophen, or even your fever drugs, whatever you have, like mefenamic acid or something like that. There is other things like clove oil. It acts like a counter irritant. Just like if you have a back pain, what we do is actually to put some counter irritants like menthol or something like that, so, or a rub most of the time. That is all to give you a counter irritant, or to get the pain out, you actually irritate your gums and things like that. That also can be done. Or it also soothes, the clove oil soothes the nerves, so it is also one way to reduce your dental pain. What if it comes from your gums? The same thing is actually possible even in the gums. So use your hot saline gargle. But there are other pains like sinus pain, wherein you don't have a cavity, you don't have food in between, but suddenly when you wake up in the morning, or most of the time it is in the morning, and when you wake up in the morning and then you feel like there is pain in the premolar area or in the molar area, and then it's a very dull ache, but it is there all across, then that is actually a sinus pain, which is actually shown as dental pain. So we have to differentiate that. And the easiest way to determine that is actually to bow your head and just bend as much as possible, so that and see whether the pain is increasing. If this pain is increasing or decreasing, that means that it is sinus, because the sinus floor is inflamed. The fluid shifts will actually reduce or increase the pain. And if it is shifting, the pain is shifting, or if the pain is increasing, then it is surety that it is sinus pain. Then what to do? Just take a whiff of very steam for 30 minutes or so. It will actually reduce your dental pain. So that is also another reason. Then the other most important pain that feels like dental pain is actually your joint pain. That is your temporomandibular joint, which is on the just in front of your ear. If you just press there, you will feel that there is pain, but it feels as though the whole jaw is paining, or the whole side of the head is paining. If it is so, then you should actually palpate your that joint, and you open and close, and if you feel that there is pain, that means that it is coming from the joint, not from the tooth. So if it is that way, then you have to give hot fermentation and just apply some oil there and then give a hot fermentation. That will reduce the pain, but make sure that you go to the dentist and check out why the joint pain is there. If there are any dental issues, is there any teeth which is missing, please correct it and get it done as early as possible, and that can give you a lot of trouble, even migraine. Most of the people come after a lot of time after going to the migraine doctor, going to a chiropractor, going to scans, and they do brain scans and everything, because it feels as though there is a lot of pain on the head. So if it is originating from right in front of your ear, and if it is not having any ear or things like that, then it should be from your joint. So please go to the dentist who is an expert in that, and please get it corrected. All these pains has to be checked with a doctor, because if you have antibiotics, see, if at all, I'll tell you that if at all you have a pain and if you cannot meet the doctor, you have to start with an antibiotic. I'll prefer something like ciprofloxacin with tinidazole with both the spectrums covered, rather than having amoxicillin plain. So take something which can cover both the thing. You ask your good friend in nursing or something where it can cover aerobic and anaerobic bacteria, so that it will reduce your pain with an antibiotic and an anti-inflammatory course. But don't use it regularly, because you don't know what is going under that, because it can be a cyst, it can be other reasons, like even a cancer which is developing, or even cyst which is actually having a lot of infection, and it is in the dangerous areas of the face that the tooth is there, and if the infection goes and get into meningitis and things like that, it will be very dreadful. So please make sure that the infection is treated, and you get out of the infection as early as possible, because we don't want any other infection to happen from here. Even the diabetes can increase with your dental infection, so please make sure that the infection is being curtailed. Then if there is a food getting in between, you have joint crowns. We have even if there is a cavity, then we can fill it with proper filling, will close the gap between the two teeth, and then you can come out of the pain. Then if it is from the gum issues, we have gum procedures. I have already spoken about that. Please look into that and get the gums treated also. Now, if it is joint pain, there is splint therapy and things like that for transient correction, and then we'll have to go for permanent correction using proper fillings and proper keeping back of whatever tooth which is gone off. So all these things has to be done with the help of a dentist. And if it is a sinus issue, if it is recurring every now and then please go and visit your respiratory medicine doctor or your ENT doctor, please, so that they'll correct your sinus issues and give you a relief from that pain also. So whatever pain is there, please make sure that you stick on to whatever advice I've given at home, but you have to go to a professional expert before you get all these things sorted out. Unless that you do that, you will get into much more trouble. So don't leave it with home remedies. Go to a dentist, a good expert, and get the thing solved out so that you will have better teeth, better smile, and a better day. Thank you very much, Dr. Thomas Nichipadam from Nichipadam Dental. I'll come with another better topic next week. Please stay tuned. Please subscribe. Thank you very much.
Wikidonus.com